So good afternoon, everyone, and welcome to Partners Member Cafe. We are so glad that you've joined us today. Right now, I'm waiting for people to pop in, so I'm going to give them just a few moments to get online with us before we start our session. So just hang tight for a few moments. Great. So it looks like we've leveled off. So again, welcome to Member Cafe for September. My name is Ann Gluff, and I am part of the member engagement team here at Partners. I am turning off the ding on my phone right now so it doesn't interrupt us. So excuse me for just a moment. All right. Again, I'm part of member engagement. And also here with me today as part of member engagement is Beth Brooks. She is the manager for member engagement. She's also today our Zoom guru, so she's going to keep everything running nice and smooth. And then we also have Kelsey Disla. And Kelsey's waving, there she is. She is going to enter information into the chat for you. So as an attendee, if there are links online, on the screen, anything, information that we think you might want to copy and paste, that'll be popped into the chat for you. I do want to let you know that one of the reasons we do Member Cafe every month is we want to create a safe space for you. It's a place for you to voice your concerns and learn about resources and services. So when we get to our Q&A section, if you have questions about other things here at Partners, you are welcome to ask those questions. So I'm sure you all know, but our topic today is bullying and through social media and otherwise, and how it impacts our youth. So we have three great guest speakers today. Beth, are you going to pop up the slide deck? Okay, so while she's doing that, what I'm going to do is give you an introduction to our speakers. And speakers, if you could, when I finish maybe when I start your introduction, if you just kind of wave your hand so they can see you, maybe say hello, that would be great. So we have three speakers today. Our first is Martil Cosper. And she is a program supervisor with the Cabarrus Health Alliance. She's got a beautiful smile for us on the screen right now. And she is over a program called Pathways to Success program. And that includes something called Stop School Violence Grant. And so she's going to tell us about their program and what it does. Our next speaker will be Michael Cooper. And Michael, he's waving. Thank you, Michael. He is the Senior Director of Advocacy for NC Child. Michael has a background in law, journalism, and speech writing. And he previously practiced law for several years on the front lines around all of these issues, journalism, speech writing. And then our last speaker, certainly not least, is Patrick Gilligan. Patrick is the founder and CEO of Somethings. And Somethings is a teen mental health mentorship platform that offers teens a safe space to talk about what they're going through. I was so excited when I heard about this app, because what a great way to meet teens where they are on an app. They can connect with an experienced peer to talk with someone about what they're going through and how they might handle it. Each of these peers is a certified peer, and I'm sure that Patrick's going to tell you more about that when he has the opportunity to speak. And before we start with Beth, are we going to show that slide with the features, or should I just go ahead? There we go. All right, so a little housekeeping. Wanted to let you know that today's session is offered in closed caption. You'll see the controls for these at the bottom of the screen. You can see that first one there says closed caption. And you'll see that at the bottom. You simply hover over live transcript to make any changes to meet your needs. Another thing, this one's super important. Unfortunately, we are unable to accommodate AI note takers. So if there are any AI note takers that pop up in our session today, we will have to remove them as attendees. And this is due to cybersecurity reasons. So really, I want you to accept our sincere apologies for any inconvenience it may cause. This meeting is being recorded. So if you have the opportunity to speak later or when you're popping something in the Q&A, please don't answer any personal, or excuse me, please don't enter any personal information that you don't want to be shared during the session. I do want to let you know that if you do have something that you want to talk about with partner staff, that we are available to you. You can send an email to memberengagement@partnersbhm.org. I'll share that information again at the end of this session if you want to connect with us one-on-one. We'd be glad to do that with you. So I did tell you that the session is being recorded. So this session will be posted probably about 10 days before it gets up there. But if you go to the partners website, partnersbhm.org, simplest way to get there, find that little search box in the upper right-hand corner of the screen and type in Member Cafe. And our Member Cafe landing page will come up and you will see this one if it's been posted by the time you get there, and also previous ones that we've done this year that you can view at any time. All right, last thing before we get started, let's talk a little bit about the Zoom features. You may or may not be familiar with Zoom, so I wanted to make sure you were aware. So Q&A. You'll see a little bubble at the bottom with a question mark in it, Q&A underneath it. That's where we really would love for you to enter any questions you may have. I don't know about you, but when I'm listening to a speaker and taking in information, I might think about a question. And if I don't write it down right at that moment or drop it into a Q&A, there's a really high chance that I'm going to forget. So we want to encourage you to just go ahead and enter your questions into the Q&A as you think of them, and we'll moderate those and make sure we get your questions answered when our speakers are done. The other thing is I wanted to point out reactions. I know a lot of us, we use emojis these days, right? So reactions is just that. So I may ask you some questions. In fact, I'm going to do that in just a moment, and might ask you to use a reaction emoji to answer the question, since we're not opened up and mic'd up for everyone just yet. Last but not least, at the end of the session, we have a survey. I know, another survey. This one is super short. Take just a few minutes, I would say 2 minutes at the most, to answer the questions. And this is very important to us. It really helps us know what information you want to hear and know how we can get better. All right, so I am going to now pass it over to our first guest speaker, and Martil Kasper, take it away.
Thank you so much, Anne. Well, I'm so excited that I was invited to provide information about our program, because one of my goals was to just make sure that people knew that we were here. I am with the Cabarrus Health Alliance, and I manage a grant called Pathways to Success. It's from the Department of Justice as part of their Stop School Violence initiatives. And so with this program, we've been able to do some great partnership with the Kannapolis City School District. Next slide, please. Our project is set up, I feel like it's a pretty unique design. The Cabarrus Health Alliance, our overall goal is to lessen the percentage of in-school and out-of-school suspension for students within the Kannapolis City School District. Our grant does have a target audience, even though we provide services that are available to the entire school body as well as the staff. Our grant is focusing right now on African American males as well as students with disabilities. And that's just not a group that we just pulled out of the air. This is really from documentation from the Kannapolis City Schools indicating that those two groups of students were more likely to be sent to in-school and out-of-school suspension. So we targeted them so that we can bring down the overall rates for the entire school district. So our very first component is our multidisciplinary team support. What we did is we decided to embed ourselves within the teams that already exist within the school system so that we can begin working with other support staff at Kannapolis Middle School, which is where I sit right now, as well as A.L. Brown High School. We have what's called a restorative practices intervention specialist. And so they sit on that team and they do case conferences of students who are referred to us for services. And if a student meets our particular background, then we will go ahead and begin providing one-on-one support for that student. We take what we call reactive as well as proactive referrals. A proactive referral may be a student who has a past history of some disciplinary concerns and they have transitioned into sixth grade. Sixth and ninth grade is our primary support. And we want them to have a really great start to the year. So before any incidents happen at all, we want to engage and create a positive relationship with that student. And so that's our proactive referral. Of course, there are reactive referrals, meaning that an incident has already occurred and that student will be referred to our intervention specialist for support. Next slide, please. Our second component is our Restorative Practices Teacher Academy. Restorative Practices is really just a framework of how to reintegrate students into the school community once an incident has occurred. So many times students may receive in-school or out-of-school suspension, and then they're just, when those 2, 3, or 4 days are over, they're returned to the school. Well, if we haven't done any repair of the harm that was caused, then it makes that transition back into the school community a little difficult. So what we've done with restorative practices, we have now begun to engage teachers and other support staff on how to help reintegrate that student back into the school community. We provide for them a restorative practices teacher academy. It's online, so it's on demand. They can take those courses at their own leisure. There are 10 courses that go over common classroom management concerns that teachers will have. So once a student gets referred to us, unbeknownst to the teacher is also referred to us for support. Because if we're working with the student on specific goals, but we're not following up with the teacher, then those things are going to continue to happen in the classroom. So the Restorative Practices Teacher Academy provides the skill set, the resources that teachers need to help better manage classroom behaviors. Thank you. Next slide. And we have our component 3. Component 3 is our student component. In the previous grant that we had, we always got a question from staff, what do you have for students? Well, this year we have what's called Too Good for Violence. This is an anti-bullying curriculum that we will have the opportunity to interface with students in all of Kannapolis City Schools. The curriculum really goes over how to be more powerful in your classroom, how to bond with your peers. And the great thing is Kannapolis City Schools already has what's called their social emotional learning time. And so we'll be able to integrate our Too Good for Violence curriculum right into a mechanism that already exists here on campus so the students can become more connected with one another, more connected with their peers and their teachers, as well as support staff that they're working with on a regular basis. And it really teaches them on how to resolve conflict. We're looking at framework for them to make responsible decisions, identifying and managing their emotions, because a lot of times kids don't know why they feel what they feel. So we really help them to be able to identify how they feel and then address it in a more appropriate manner. And so that curriculum is going to be implemented starting, we hope, as soon as January here within Kannapolis City Schools. And we hope to see some great impact as we do that. So with our program, we have 2 staff members. I have a restorative practices specialist here at Kannapolis Middle School and one at A.L. Brown. And so we're hoping that as we work with students as they are transitioning into that 6th and 9th grade, that it's going to make an impact for them. We find that students, when they're coming into these transitional grades, you're kind of like going from the big fish when you were a 5th grader in elementary school. Now you're in a smaller pond because you're back at the beginning again. We've all experienced that in our lives. And same thing when you're in 9th grade. In 8th grade, you were the big kids at school. Now you're back in 9th grade and you feel like you're starting over again. So we really want to provide them with that support to transition. And we find that when we provide that support for them as well as the staff, the number of disciplinary referrals will begin to drop. They are high in the beginning because the teacher doesn't know the student doesn't know the teacher. They don't know common things that will occur with that student and how to address them appropriately. So hopefully we're creating that bond between them so they have the opportunity to develop a relationship, and that way the behaviors in classroom are better managed. Mhm. And that's what we do with the Pathways to Success program. Thank you so much for having me today.
What a great program. Um, so it's good to know that that program is going on. So I want to ask just a couple of questions to our
Sure.
attendees. So if you are aware, perhaps you're a parent and you have a child in school, or maybe you're just very familiar with the schools in your area, are you aware of programs going on in your particular schools? If you are, can you just throw up a thumbs up for me? So we can see how many of our attendees are aware of any programs going on in their schools. I got a couple there, one, two,
Mhm.
couple more. Okay,
Great.
well, that's really good to know. So here's another question for you. I'm still getting another one. All right, so I have another question for you. How many of you, or perhaps your children, have experienced bullying when you were in school? I know when I was in school, there was no social media, but I will tell you that I did experience bullying. I didn't know who to talk to or where to go. So I see quite a few thumbs up, whether they have a child or they have maybe they experienced it themselves. And so my next question, and for this one, for the answer, I want you to use a heart. We're limited in how many different options we have.
Mhm.
If you experienced it, or perhaps your child experienced it, did you know where to go to get help? Did you ask for help, or did your child ask for help? That's good. Wow, that was only one. Oh, there's a couple more. Love it. So I know when I was in high school, I was just what she mentioned earlier about being in that transitional place. I was going into high school. I actually was coming out of a Catholic school, going into a public high school. And as a freshman, I was bullied by some upperclassmen. Didn't tell my parents, didn't know who to talk to at school. It was very disconcerting and was really rough entrance for me into high school. So yeah, it's really good that we do have some resources. All right. So now I would like to move on to our next speaker. Our next speaker is Michael Cooper, and he is the Senior Director of Advocacy at NC Child. So take it away, Michael.
Awesome. Thank you so much, Anne. Really appreciate the opportunity and the invitation. Great to be with you all this afternoon. It's a real sort of joy for me. I'm from Wilkes County, so a very similar part of North Carolina, up in the foothills in the western part of the state. So, really interested in making these connections, learning about the work that y'all do, and how we can partner together. So, as Anne said, I work now for NC Child as the Director of Advocacy. Have been with NC Child for just over a couple years now. Before that, I was in the courtroom practicing law as a defense attorney in the foothills of North Carolina. So got to be on the front lines of a lot of these issues and did a lot of juvenile delinquency work. And so represented countless young people caught in the system. Mental health showed up in a lot of that, substance use disorder and a lot of that. So the opportunity now to work for NC Child and to get to advocate for many of them and for many of these issues is a real sort of blessing, and want to try to make the most of this opportunity. So would love your help in doing that. So next slide. For those who don't know NC Child, we've been around since 1983. So we've done this work. We've partnered with lawmakers and local leaders and community advocates and family leaders to advocate for policies that improve the lives of North Carolina's children. That has been our mission for 4 decades now. That remains our mission. Next slide. And so the focus of our work is policy advocacy, particularly here at the General Assembly in Raleigh. We do some national stuff, we do some local stuff, but our big focus is on state level policy change in the state of North Carolina. Over the years, we've worked on issues like child welfare, juvenile justice, family economic security. We helped to establish the Child Fatality Task Force in North Carolina. We were part of the effort to expand Medicaid in our state in recent years. And our focus today are on some big issues: early childhood education and access, child welfare, and then youth mental health. And that's very relevant to what we're talking about today. And we're going to get into some of the stuff that we're seeing on this issue of youth mental health. Next slide. And so NC Child, we're known as a trusted source of data and information. If you want to give us a thumbs up, or if you've heard of NC Child or our research before, feel free to throw that. So, since 1986, we've done something. We've done county level data in the state of North Carolina, originally called the North Carolina Children's Index. We were the first state in the country to do annual state and county level data on the issues affecting children. That went on to inform what the Annie Casey Foundation does through the Kids Count Data Book, which we support and help to release. And we also partner with the North Carolina Institute of Medicine on a biannual child health report card. You may have heard of that, or our annual county level data. Next slide. So in the latest child health report card that came out earlier this year, the results were mixed, kind of like my report cards in grade school. We got an A for insurance coverage, a B for maternal health and support, but North Carolina also received some pretty poor grades for oral health, healthy eating, active living, education outcomes, and we received a failing grade for youth mental health. And we're going to get into that. Next slide. So what we saw in some of the latest data in 2023, about 4 in 10 of North Carolina high school students reported persistent feelings of sadness or hopelessness to the point that it disrupted their normal day-to-day life. 4 in 10 reporting to that. Next slide. As many of y'all are familiar, we've also seen a substantial increase in the amount of children in North Carolina diagnosed with anxiety or depression. Between 2016 and 2023, the number of children in North Carolina with a diagnosis of anxiety or depression more than doubled. From 2016 to 2023, more than doubled. Around 386,000 North Carolina children today have that diagnosis from a medical professional. Next slide. Related to that, in part because of it, we've also seen a rise in suicidal ideation. The number of youth suicides in North Carolina has more than doubled since 2010. More than doubled. Now it's around 4 per every 100,000 children in North Carolina. In 2021, about 1 in 5 of our adolescents seriously considered attempting suicide, and about 1 in 5 made an attempt. And I'll repeat that. It really stood out to me when I first heard about it. 1 in 5 seriously considered attempting suicide. 1 in 10 made an attempt. That is not normal. And that is not just a North Carolina issue. We've seen rates of anxiety, depression, suicidal ideation rise across the country. There are several factors, all of this showing up in your work. The pandemic was a big disruption and didn't help. Those months of isolation for young people were a precursor and an impact on all this. But the data also shows that these issues were happening before the pandemic. And some of it's tied to the rise of technology, to the rise of the iPhone and social media, and how that's impacted teenagers. Today's teens are now spending an average of 4.8 hours a day on social media, and that has been linked to increased rates of anxiety, depression, to bullying, and to eating disorders. So I think next slide, we'll go on to it. So that's why we're working to advocate for policies that are addressing this. We spoke out in favor of, I don't know, give me a thumbs up if you heard about the phone bill earlier this year in North Carolina. So there was an effort to restrict phone use during school instruction time. NC Child spoke out in favor of that. It doesn't solve everything. It also doesn't restrict it during the entire day. It's just during instruction time, which when you think about it, students shouldn't be on their phone during instruction time anyway. But what we've done is we've codified that. That is a step in the right direction. There is maybe some interest in doing it bell to bell. Other states are looking at that, and we're going to continue to monitor that. Some of the things we're also talking about and advocating for is suicide prevention training for school personnel. We want it mandatory every year, 2 hours of suicide prevention training for every teacher in the classroom in the state of North Carolina. We think that would help to make a difference. We also want to increase access to telehealth counseling to make it easier, particularly in a lot of these rural areas, a lot of the areas that y'all are serving, making it easier to get access to mental health care. Next slide. So, a lot of this is actually, you go on to the next one too. There we go. So a lot of this is tied to larger issues that are going on in the country. There's a youth mental health crisis, but that's also part of a larger mental health issue that's going on, tied to issues of loneliness, to isolation. Today's young people, we've seen statistically, young people today have fewer friends than previous generations. They're less likely to date, less likely to get a driver's license, less likely to work a part-time job than previous generations. Some of the other interesting things we've seen, you probably have seen this in your work, according to the Youth Risk Behavior Survey from the CDC, going back to the 1990s, the percentage of high school students who drink alcohol or having sex or getting into fights has been cut in half since the 1990s, which in some ways are things that we wanted or things that we celebrate, some of the declines of some of those behaviors. But at the same time, that's connected to what's going on with these issues of loneliness, isolation, social disconnection. Teenagers are just not out doing more things. And so some of those behaviors are just declining because they're not out seeing friends or being in relationships. There was a news article that really stood out to me, I think it was last year, and the headline was, Gen Z are so lonely that they are posting friendship applications on Facebook. Really just, astounding seeing something like that. And so, we've seen how these issues are connected in various ways to the technology. We saw this one study came out a couple years ago from the Center for Countering Digital Hate, which found that TikTok accounts, a new account on TikTok was shown self-harm and eating disorder content within minutes of being on there. Suicide-related videos popped up within 2.6 minutes. Eating disorder content popped up within 8 minutes. I think you go on to the next slide. Actually, that's the end of it. Okay, well, or you maybe go back. There, we'll stay on this. Actually, go one forward. We'll go to that final one. The one you had. There we go. We'll end there. So this is connected. What you see on the screen. Last year, we did some research with a think tank called Capita, which is run by a friend of ours, Joe Waters, who lives in Blowing Rock, North Carolina. They do a lot of work on issues affecting children and families across the country. And we did some focus groups at the end of last year on several of these issues. Focus groups with teenagers across the state of North Carolina and some with parents of young children. What we found, the pandemic was a big issue. That's had an impact on antisocial behavior, on school attendance, on bullying. That's increased. But today's teenagers are also feeling this real intense pressure to succeed, whether that's getting good grades or pleasing parents or getting into college. They feel a lot of not just peer pressure, but pressure from adults to succeed. And they're also feeling, a lack of outlets and opportunities to be with their friends. Technology is a big issue, but so is sort of the decline of third places, of having places to go and to be with each other and to sort of build bonds and build connections. And a lot of that is showing up in the different behaviors that we're working on. When teenagers are not used to socializing and being with one another, that makes it more likely that they're going to act out, and then they're not going to know how to behave in certain ways in the classroom and outside of the classroom. So this is a really important issue. Bullying is one big aspect, the mental health crisis, part of it as well. We're trying to address it. There is no sort of one fix to any of this, but we need your help. We want to hear directly from you. My email is michael@ncchild.org. Feel free, please reach out to me if there's ever an opportunity for us to be out there on the ground to present or just to hear about what's going on. We have the statistics and the data that NC Child is known for, but we need stories because stories are what move people to action, particularly here in Raleigh at the General Assembly. If you ever want to come to Raleigh and help us advocate for things that will improve the lives of our young people, let us know. We will welcome you. We will take you around So thank you for the work that you do. I know this is a very important time. There's a lot going on, but I think that if we can connect the dots on these issues and let folks know that young people need our attention, there's a lot of changes going on in the world right now, and we need to make sure that our young people are prepared and that they have a voice. And if we do that, they're going to be okay. So thank you for your time. I really appreciate the opportunity to be a part of this.
Thank you, Michael. What great information. When I think about all of this, I think about my grandchildren. They're young. I have one in the fourth grade and then another little peep. But they're growing up in a different world than we grew up in. I think all of us here than we grew up in. It's just a different way that we need to navigate this world. And just those statistics that Michael gave about 386,000 kiddos diagnosed with anxiety and depression. That is just it really, really hurts my heart for that. So how many of you all know somebody that is a young child, a youth, a teenager that is affected by depression and anxiety? You can pop a heart or a thumbs up into the reaction. It's everywhere. And so I think it's really important that we listen to our experts that we have here today about how we might approach things. And if y'all have comments, not just questions about things that you're aware of, feel free to put those into the Q&A as well. If there are other resources that we can share with you all, that would be great. All right, so next I want to pass the mic over to Patrick Gilligan. And again, Patrick is the founder and CEO of the Somethings platform. Patrick, I took the liberty of just popping something together for you. I didn't know if you had anything to share or does this work for you? Okay.
I do have some slides, and apologies for not getting to you
No
earlier.
worries.
So
Did you want to share the slides?
yes, that would be
Okay.
great. Give me 1 second.
We're pretty flexible here. We like this to be a pretty casual scenario because we really want to get our audience engaged and we want to answer their questions. If there's anything we can do to provide information and support for you. I know Kelsey's dropping some things in the chat. So Kelsey, if you maybe could drop the Somethings app information in there and Cabarrus Health Alliance with Martil Cosper and the Stop Violence program, that would be great. And if y'all have other information about other school systems that have programs, that would be wonderful as well.
Okay.
All right.
Can you all see this?
Sure can. Go ahead,
Awesome.
Patrick.
Well, we're really excited to be here as well. I know we just spent the last few minutes talking about the problem of youth behavioral health across the state, and I'm very excited to be here showing one of the many solutions that the state has been supportive in trying to bring to help solve some of these issues. So I'm representing a company that I started called Somethings. We are a virtual platform for teenagers across the state of North Carolina to get connected to mental health support, specifically to get connected with certified peer specialist mentors. And I'll talk a little bit more about how it works and sort of everything about our platform. But I do think the framing that we just learned and heard about is a really good framing. There's a huge problem across our nation and across North Carolina. And many teenagers and young people are really struggling. And, we set out to really find a way to actually reach kids today who do spend the time that we talked about on social media, who are digital natives. And we really learned in our research and through the thousands of teens that we've served that there's a really different way that you have to reach these teens and young people if you want to help them feel better. And so, what we learned really, and I'm going to skip through all this because you all know all these things given the last speaker. So thank you for that. But what we heard really was that a lot of the resources that teens and young people had tried really felt not relatable to them. This includes clinical treatment, but it also includes other forms of support. they really felt like they didn't want to have to explain some of the difficulties and the nuances of the life they lived with the people that they wanted support from. And we kept hearing this theme about, I don't necessarily need a therapist or a psychiatrist. I just want someone to talk to, who's young, who gets me, who can be there for me in a very like lightweight way. And so out of that really came some things. And the idea was, why don't we use the large amount of young but older young people, the 20-something-year-olds who've actually gone through the challenges that teens are facing, and why don't we train them and get them certified as peer specialists to provide support to teens who are currently going through it? And so we created some things which allows teenagers ages 13 and up in North Carolina to, via our mobile app, connect with a certified peer specialist mentor, who can provide support in a relatable, easy to access way via a mobile app on their smartphone, to make sure that no matter what a teen is doing in their life or where they are, whether they are after school running from practice, whether they don't have access to a clinical support network in their community, they can just pull up their mobile phone and get access to our platform and have someone to talk to. And I think I breezed over it, but we were enlisted in November of last year by the North Carolina Department of Health and Human Services to provide this service to any teen across North Carolina who needs it, totally for free, all supported and funded by the state. The idea being to try to provide really easy to access, low stakes way for teens across the state to get any sort of support, because we know that the alternative is that many teens are not accessing any form of support and struggling in silence, which is not a good thing. So the way it works is really a few fold. So the first is every teen who joins our platform gets access to connect with one of our certified peer specialist mentors. All of our mentors are supervised by licensed clinicians to make sure that the way that they are receiving support from our mentors is appropriate for what that youth needs. In addition, in our app, teens can access crisis resources 24/7. This includes 911, 988, crisis text line, just to make sure that if they ever do need someone, there's a place on their phone where they can go reach out easily. And then for some teens, this is not supported by the state directly, but for some teens who are looking for more clinical resources, we can either help connect them with a community resource that we are connected with across the state, or we can try to connect them with one of our therapists in-house if they are supported by one of our insurance partners. To make sure there's no confusion about that, our peer mentor platform is available to any teen across the state. There's no exclusionary criteria. Our clinical network is supported by insurance partners across the state. And the point too that I'll share, and what we've learned from the data, is that a lot of teens who are struggling are not going to seek out clinical resources, even if they need. But we've seen that they will seek out somebody who is a paraprofessional, who is a peer, as a stepping stone in. And so being able to have a peer mentor as the way into mental health care, we found helps kids get comfortable with the idea of clinical care. And our clinical team, alongside a teen's mentor, can help navigate and support teens in finding the right level of care, whether that be just the peer mentorship or whether it be something in addition. I'll skip this. Like I said, we've served thousands of teens across the state to date. We've lots of 5-star reviews on our app store, which is where teens can access our resource. I'll leave this and you can check it out afterwards. We're currently serving teens across 80 counties of the state, which is very exciting. Our goal with the state Department of Mental Health is all 100. So we are trending towards there, and really hoping to get there by the end of the year. To show some data about the platform, because obviously we want to make sure that what we're doing works, it's effective. We see on average that our platform is available to teens. They can talk to their mentor after school hours throughout the week, and their mentor is live and online, ready to support them for about 25 hours throughout the week. On average, we're seeing teens get matched with a mentor and get started talking in about 6 hours after applying to the program. So they can get support in hours, not days or weeks, as compared to other resources. On average, we're seeing teens talk with their mentor over text or video call on our mobile app about 8 days every month, which is very cool. And then we have a 4.7 out of 5-star average satisfaction rating. We've also recently started publishing our first set of studies, and we've seen that and this is all from data in North Carolina. We've seen that after 75 days in the program, teens in our program were 65% less likely to screen positive for depression and 40% less likely for anxiety. And these are teens who are just using that peer mentorship support. So very excited. We're constantly trying to publish new studies about the effectiveness of the program alongside the Department of Mental Health. So that's all I have today. Thank you all again for listening through the awesome speakers today. I'm very grateful to be a part of it. And yeah, excited for questions.
Great, wonderful information. So yeah, really great information across the board, really nice. So this is your opportunity to ask questions. I know we've gotten a lot of thumbs up and heart emojis and all. We do have someone in our Q&A asking about information to support the Hispanic and Latinx community. So if anybody is aware of specific information, that would be great if you can pop it into the Q&A. Let's see. Another question we have is, if a teen already has a therapist, could they still get peer support through somethings?
Yes, so our service is non-exclusionary, and the state has asked us to use it as an additional support for whatever teens might already have in place. So yes, no matter what current resources the teen has in place, they can use our service in addition.
Okay, so I'm not seeing anything else. So again, this is your moment. You can ask questions. So Patrick, I do have a question for you myself. When I first read about some things, I remember seeing something about parents, how they could be aware that their teen was on the app. Is that still the case, or can you share a little bit about that?
Yeah, so during our onboarding process, teens can select whether or not to include a parent or guardian. It's obviously highly encouraged for us to include them. However, along with the state, we did identify that some teens identified involving their parents as a blocker to receiving care. So for teens who do opt in to involving their parents, we will reach out directly to them, offering both like overview calls with the program as well as ongoing check-ins if they'd like. And in addition, parents have access to selective information based on what the teen has shared with them via our mobile app.
Patrick, is the Something's app available on both Apple and Google?
Yes, that's correct. It's on the iOS store and the Android store.
Thank you.
And I think you're on mute if you were speaking.
I was, and Beth was giving me her super simple, I can't even talk today. So my computer has timed out on me. I was trying to get back to where I needed to be. So I do have a question for Martel. If you don't have any more questions, Beth. Okay. Are there other NC Stop Violence programs across the state that you're aware of?
Yes, there are many. The grant that we currently have was an award of 23 throughout the country. So we were able to garner a $1 million grant, and 22 other organizations throughout the country were able to receive that. Prior to our current grant, we had one, the Stop School Violence grant, that really focused on training of educators. So we did a lot of training within the Cabarrus County schools as well as Kannapolis City schools of staff on Reconnect for Resilience, which is really a brain-based program on teaching students on how to be present in the classroom. and as well as our restorative practices program.
Thank you. All right, I see one more question in there. It says, Michael, how can parents get more involved in the work NC Child does?
Wonderful. So that's a fantastic question. We are actually getting ready to recruit for our next cohort of our Parent Advisory Council. So if you'll sign up on our website for our newsletter, applications will be open here in a few weeks for that. We're also going to be opening for our cohort for our Early Well family leaders, which will include parents as well. And we have a staffer out in Western North Carolina who's a regional community engagement manager. We'd love to connect you with them. So please give me an email address. Give me an email if there's ever anything I can do. We would love to engage parents and families to help advocate for what's going on in their children's lives. So please stay in touch.
All right, any more questions? Right. I am not seeing any questions. So I guess we will move on. I do have some more information for you from partners. So Beth, if you want to go ahead and bring those slides back up, that would be great. All right, so I wanted to throw this at you right now. This is your way to give us feedback. There's a QR code and there's a link at the bottom. I do have a little bit more information to share with you, but I thought if you wanted to, and you're very industrious, you can grab your phone, grab that QR code, or you, let's see, Kelsey, can you put that link, if you haven't done it already, can you please put that link in the chat so they can connect to the survey very easily? And then as I'm sharing the final couple things I want to tell you about Partners Health Management, you can fill out this survey so we don't take any more of your time after our session is over. All right, you can go on to the next slide, Beth. So this slide, if you are a regular member of Member Café, you attend often, you've seen this before. This is all of our contact information. You know, we have our Partners Access call line for member and recipient services. There are several numbers here on the page. The majority of the numbers below, except for one, which I'm going to share with you in a minute, you can get to by this number at the top, 888-235-4673. That's our main access line. There's a menu that you can choose from to get to where you need. And that menu is going to allow you to get to any of these below here: pharmacy, nurse advice line, non-emergency medical transportation, behavioral health crisis. Behavioral health crisis line, this one is available 24 hours a day, 7 days a week. That's the number right there on the screen, 833-353-2093. The nurse advice line is also available for our tailored plan members, 24 hours a day, 7 days a week. And this is a nurse triage line. You have questions about maybe your child has a fever or something's going on, you can, or there's a minor injury, you can call and ask questions. Our pharmacy services line, also 24 hours a day. One thing I wanted to really point out is Teladoc. So Teladoc, we have our members can have access to virtual care. So to get connected to that, you simply need to go to the Teladoc website to register. And Kelsey, if you could pop that into the information in the chat, so it would be really easy to copy and paste. If you're having trouble registering, you can call Teladoc. The number's right there on your screen. We could pop that into the chat as well. 800-835-2362. Yes, let's try that again. 2362. for assistance in registration. And this is for, physical health, behavioral health, whatever your needs are, and you can connect to that there. And then at the very bottom, this is for our providers. So if you're at your doctor's office and they're asking you a question about a process that we have here at Partners, this number is actually on your member ID card if you're in Taylor Plan, and it's there, but this is the number that they need to call. And then also, most importantly, at the bottom of the screen, well, not most importantly, member engagement. If you want to contact us and have some one-on-one time to talk specifically about a family member, about yourself, you can send us an email at memberquestions@partnersbhm.org, and we'll get back to you just as quickly as possible, typically within 24 hours. So go ahead to the next slide, Beth. This is some additional contact information. The North Carolina Medicaid Ombudsman. That is somewhere you can call if you feel like you're not getting the service that you feel like you should be getting from your doctor, your therapist, whatever provider you're utilizing that is under Partners Health Management. You can call the Medicaid Ombudsman and they can help you out. The other one is the NC Enrollment Broker. They can help you out if you need to register with a plan or you need to switch plans. They're great information there. There's the Medicaid Contact Center in the center there. That's for our providers. Local DSS, really important. If you're a Medicaid member, it's so important to keep your information up to date. If you're with the tailored plan, you can do that here with us at Partners. If you're not, you go through your local DSS and they're going to keep your information up to date in their system. Their system informs our systems every day. So you update it with them and it comes to us. All right, next slide. If there is a next slide, okay. All right, here's a good one. If you want to be in the know and stay connected with Partners Health Management, we have some news emails that go out on a pretty regular basis. So if you want to stay connected, you can go to subscribe on our website. Kelsey's going to put that in the chat for you. You can also grab that QR code and get there. Another easy way to get there, go to partnersbhm.org. Health, our website, and put subscribe in your search field at the upper right hand corner. It's going to take you right there, and that will help you get connected with that newsletter. Do we have anything else, Beth, or did we end there? There we go. Thank you for attending. So a great big thank you to our guest speakers today. So to Martel, to Michael Cooper, Patrick Gilligan, thank you so much for sharing your expertise in these arenas. I'm sure it was great information from all three of you. And so again, thank you for being here. And thank you to our attendees for sharing your time with us today. And so next month, October, is another member cafe, and we are going to be focused on employment and for individuals with intellectual and developmental disabilities. We have a guest speaker from what used to be called North Carolina Voc Rehab, and I don't have it in front of me, so the newest name of that always escapes me, but North Carolina Rehab will be here next week to tell you all about the program for integrated employment. All right. So again, thanks for being here today. Answer that survey for us. Just take a few moments. We really appreciate that information. And y'all have a great day. And we hope to see you next month. All right. Bye, y'all.